So a warm welcome to everybody who is joining this session. We are delighted to have you with us. A reminder that we have interpretation available in English, Spanish, French, Russian, and Arabic. You will see at the bottom of your screen an icon that looks like a globe. You will click on that and be able to select your language of choice for interpretation. So you are most welcome to this session. We will just give it a minute more while other colleagues join before we begin. So a warm welcome to everyone from around the world to this session on improving diets through labeling and marketing restrictions. We are delighted to have you with us. I do want to remind everybody that this session is being recorded. If you object to being in a meeting that is being recorded, we would have to ask you to leave the meeting. But the recordings are going to be made available on the Health Week website, so that other colleagues who are unable to join us today will also be able to still listen to this important dialogue and conversation. So a warm welcome to everybody. And as we get going, I'm going to tell you that this is the 7th out of 8 sessions in the Health Talk series that has been held as we prepare for the Nutrition for Growth Summit. The WHO and UNICEF are hosting this week-long series of webinars that focus on improving nutrition through a multi-system approach. If you missed any of the other sessions, and there have been some really excellent ones, you'll be able to go to the Health Week website and listen to the recordings of them. Today, we are going to be addressing the very important subject of improving diets through the labeling and marketing restrictions. Both of these policies are really cost-effective and relatively inexpensive compared to behavior change interventions with individuals. And we know enough now to be able to act now. And as we head for the N4G with countries making commitments, here is an ideal opportunity for countries to consider a commitment around labeling and marketing restrictions. As we get going, I invite you all to enjoy welcoming and saying hello in the chat box. Please use the chat box just for welcoming. It's lovely to see colleagues from around the world joining us, so do say hello in the chat box. If you have any questions that you would like to ask, then you will put those in the Q&A box. So please only use the Q&A box for any questions, but do say hello in the chat box. So as we begin this session, let me hand over for our opening remarks to Katrien Engelhardt, who is a scientist addressing healthy diet policies in the Department of Nutrition and Food Safety at the WHO in Geneva. So Katrien, I know to you I can say good afternoon, but over to you to give us the opening remarks.
Thank you very much, Jane. Yes, so good morning, good afternoon, and good evening to everyone who joined us today. As introduced by Jane, today's session will focus on improving diets through labeling and marketing restrictions. So the question is, why are we focusing on these topics as key priorities for countries to promote safe and healthy diets, to ensure health and well-being for all, and to leave no one behind? So the short answer, and we'll address it in a bit more detail throughout the session, the short answer is the current food retail environment offers an unprecedented selection of heavily processed packaged foods that often undermine healthy diets. And foods that are marketed are predominantly foods that also undermine healthy diets. And as we all know from our everyday lives, labels can be rather confusing and misleading. So the second question is, why have we decided to focus on these two topics in one session? So of course, the availability of time slots was definitely a reason to merge these two. But actually, even more importantly, was that we do see very critical parallels in these two topics. Our food values are central to our food choices, and they go beyond the taste, they go beyond safety, healthiness, convenience, and the price of foods. Actually, the elements of the food environment which surrounds us, in particular how foods are marketed, and also how they are labeled, including how they are packaged, are recognized as shaping and changing our consumption norms and affecting our food value systems. So marketing, by definition, is intended to create a desire to purchase and to consume foods. And unfortunately, as mentioned, food marketing is predominantly for foods that are unhealthy and undermine healthy diets. Marketing may mislead consumers to believe that foods are healthier than they truly are. And labeling is used as a marketing tool by the food industry. For example, when unfounded or inappropriate health and nutrition claims are made. And the nutrition labeling of packaged food is considered to be actually the primary means of communication between the producer and the seller of food on the one hand, and the purchaser and consumer on the other. And nutrition labeling should definitely inform the consumer of the nutritional properties of a food to support their purchase and consumption decisions, and importantly, should prevent labeling in a manner that is false, that is misleading, that is deceptive, or that is likely to be erroneous, to create an erroneous impression about any characteristics of the specific product. So while restricting marketing and ensuring truthful, understandable labeling are most often implemented as two separate policy options, they are actually both a critical part of a comprehensive package of legal measures to promote healthy diets. And importantly, they have the complementary goal to ensure the right of consumers to non-misleading and to truthful information. And they both play a critical role in shaping our food values. So with this session, we hope to drive ambitions and impactful country commitments at the Nutrition for Growth Summit in December to protect all children from the harmful impact of food marketing and to ensure that labeling policies are implemented that prevents labeling in a manner that is false, misleading, or deceptive, but rather that inform the consumer of nutritional properties of a food to aid healthier purchase and consumption decisions. So I very much look forward to our discussions today. And on behalf of my colleague, Kathy Schatz from UNICEF, Fabio Gomez at WHO PAHO, Holly Rippon from WHO Euro, I would like to extend a warm welcome to everyone that's taking time to attend today or that will listen to the recording. Thank you very much, and back over to you, Jane.
And thank you, Katrine, for really highlighting how important this topic is. A topic also close to my heart, as we really see how pervasive and persuasive marketing can be and how detrimental it can be to us trying to achieve the goals of good and optimal health for all. So it is a great pleasure now to get a country setting of the scene, because these actions are actions that happen at the country level. And so it is my privilege and pleasure to welcome a colleague of ours from the Republic of Chile, and Senator Guido Giraldi. It is wonderful to have you with us. And I know that we're going to start your session off by firstly playing a short video, and then the floor is going to be yours, sir. So let's start with the video.
Estamos ante una epidemia de sobrepeso, obesidad y diabetes.
Toda América va a buscar este modelo de etiquetado nutricional.
Los octógonos nuevamente han llegado para quedarse.
Estamos viviendo una situación muy dramática, aumento de la obesidad de manera gigantesca. Que lo que está ocurriendo en Chile está ocurriendo en todas partes del planeta. Los mismos Kellogg, los mismos Nestlé, una industria de la sal, del azúcar y de las grasas saturadas y de las calorías.
Esta esta ley mandató al Ministerio de Salud a establecer límites para esto que llamamos nutrientes críticos. Esos límites, a su vez, direccionaban a 3 normativas. Una, un nuevo sello de advertencia. Cualquier alimento que sobrepasara los límites no iba a poder hacer publicidad dirigida a niños.
Como no son saludables, no se pueden vender en colegios y no pueden haber compras públicas del Estado.
Los niños hoy día están expuestos a la mitad de publicidad de alimentos poco saludables que veíamos antes de la ley.
Gracias. Senator, over to you.
Muchas gracias por la invitación. Bueno, muchas gracias por la invitación. Este es uno de los temas más apasionantes y desafiantes para la salud del siglo XXI. Yo diría que estamos enfrentando uno de los mayores problemas, que es esta pandemia que yo llamo la pandemia silenciosa. De mi punto de vista, la pandemia de obesidad y de todas las consecuencias que tiene es más grave que la pandemia del COVID. Pero la diferencia que, a diferencia de lo que ocurre con el COVID, que ha generado una conciencia mundial e instrumentos para enfrentarla, esta otra no tiene políticas. Y no tiene políticas porque es un gran negocio en realidad, porque lo que estamos hablando acá es de un modelo de consumo, un modelo de desarrollo, es un gran negocio para las transnacionales de la comida de basura, que son gigantescos recursos que están puestos a disposición de cambiar los hábitos alimentarios saludables por hábitos que no lo son, y luego es un gigantesco negocio que está coludido con lo anterior de la industria farmacéutica, porque en vez de resolver los problemas de salud, generamos paliativos tecnológicos para mantener, entre comillas, una situación, pero que no recupera la salud. Hoy día el 60% de las ganancias de la industria farmacológica, de la industria de medicamentos, tiene que ver con productos que están hechos para enfrentar todo lo que son los temas de obesidad y sus consecuencias. Los gastos de los países van a ser gastos que van a ser impagables. Países como los nuestros ya están gastando más de 4 puntos del Producto Interno Bruto en todas las consecuencias que tiene esto para la salud. Además, este es un tema social, porque son los pobres del mundo los obesos, son los pobres del mundo que tienen una mayor carga de enfermedad, y es tal vez el mayor problema social. Son pobres desnutridos. En Chile, más del doble, es el doble de riesgo que tiene una persona pobre de ser obeso, es el doble de riesgo que tiene de tener cáncer, de tener infarto. Por lo tanto, uno de los desafíos sociales más importantes que tiene nuestra humanidad. Y luego tenemos además evidencia que vamos a vivir en un mundo pandémico, y sabemos que el ser obeso genera el doble de riesgo de morir por COVID, o el doble de riesgo de tener hospitalizaciones graves por COVID. Por eso que esto es un tema que es un desafío que es insolayable. Ahora, ¿cuál es el problema de esto? Primero, yo creo que tenemos una trampa, y la Organización Mundial de la Salud nos tiene que ayudar, y OPS y UNICEF, porque no pueden seguir llamándose enfermedades crónicas no transmisibles, porque son las más transmisibles de todas. Estas enfermedades son mucho más transmisibles que las enfermedades virales, que las enfermedades bacterianas, porque se transmiten a través de la publicidad. Y la publicidad está hecha con neurociencia, está hecha con psicólogos, está hecha para intervenir los cerebros de las personas. Y la industria de la comida basura actúa igual que las tabacaleras. Ellos saben que mientras antes logren hacer que los niños y niñas consuman basura, antes van a ser adictos, y van a ser adictos por más tiempo en la vida. Igual que el tabaco. Y su gran estrategia es enganchar a los niños y hacerlos adictos desde muy pequeños a través de los sistemas o circuitos de recompensa de dopamina que están asociados al consumo de sal, grasa y azúcar, porque evolutivamente en el pasado, para sobrevivir, nuestros ancestros, para comer, liberaban sal, grasa y azúcar, y por lo tanto esto es parte de un modelo evolutivo. Pero además hoy día hay cambios porque gran parte de la publicidad se está desplazando a los medios tradicionales que eran posibles de regular, se están desplazando a medios que no son posibles de regular. 80% de la publicidad hoy día se está yendo a internet, es una publicidad personalizada, los niños las ven al jugar en los videos, la ven al entrar a sus páginas de Instagram, a TikTok, y por lo tanto tenemos un problema gravísimo de la intervención de los cerebros a través de mecanismos súper sofisticados de neurociencia para capturar su atención y luego para que liberen dopamina y por lo tanto que se hagan adictos a las pantallas. Ya un niño que tiene entre 6 y 8 años tiene en promedio 4 o 3 horas de pantalla, y un niño que es adolescente, entre 13 y 18 años, tiene 6 horas 40 de pantalla. Hay una adicción que justamente genera problemas que son muy complejos. Luego, yo diría que esto además tiene una consecuencia, son enfermedades epigenéticas. Es decir, ¿qué quiere decir que sean epigenéticas? Que la condición de ser obeso se va a transmitir a las generaciones futuras por procesos de metilación y desmetilación de genes. Por lo tanto, no estamos hablando solo de los problemas actuales, sino también futuros. Y por último, altera no solamente los mecanismos metabólicos, sino los mecanismos de frontera de la medicina, que son los biomas, que son las bacterias que tenemos en nuestros cuerpos, que definen también parte importante de nuestro comportamiento, nuestro estado de ánimo, nuestras enfermedades. Recuerden que somos más bacterias que seres humanos. Solo el 1% de nuestros genes en nuestros cuerpos son humanos, 99% son bacterianos, 40% de las moléculas de nuestra sangre son bacterianas, y por lo tanto hay una alteración global. Aquí hay una violación de derechos humanos. Cuando yo hablo de publicidad, las grandes industrias de la comida chatarra están violando todos los días los derechos humanos de las personas porque tienen publicidad engañosa. Y por eso nosotros los hemos acusado a nivel internacional de ser los pedófilos del siglo XXI, porque abusan de los niños. Y yo creo que esto es algo que debiéramos enfrentar a nivel mundial. No podemos permitir que los alimentos sean los principales generadores de problemas de salud en el planeta. Nosotros tenemos una carga de enfermedad gigantesca y, por lo tanto, no podemos seguir llamando al cáncer, no podemos seguir llamando a los infartos al corazón, al cerebro, a la hipertensión y a la diabetes enfermedades crónicas no transmisibles. Son las más transmisibles de todas. Y mientras no cambiemos ese concepto, no podemos luchar. Porque si no tenemos un diagnóstico adecuado del problema, si no son transmisibles no hay nada que hacer, no se puede cortar la cadena de transmisión. Ahora, si son transmisibles, tenemos que cortar la cadena de transmisión, que es la publicidad. Por eso que la ley que nosotros hicimos, lo primero que hace, establece un derecho humano, que es el derecho a saber. Yo tengo acá un cereal de Nestlé. Esto es basura. Y lo que nosotros hicimos es imposible leer ese etiquetado. Yo no lo entiendo. Ellos querían el GDA, que es ese etiquetado que está ahí. El GDA no lo entiende nadie. Ellos han hecho un etiquetado para que no se entienda, para falsear la información. Ellos saben lo que ponen dentro de este paquete, pero las personas no saben. ¿Qué es lo que hicimos nosotros en el año 2007? Presentamos yo mismo un proyecto de ley que tuvo un lobby gigantesco en contra para que hubiera derecho a saber. ¿Qué significa? Que estos sellos, que pueden ser 4, uno para sal, otro para grasa, otro para azúcar, pudieran ser identificables por un niño de 6 años. Hicimos focus group con niños y fueron ellos que nos dijeron que lo que entendían mejor era estos sellos. En este caso dice alto en azúcar y alto en calorías, pero podría tener también sal. Antes tenían la basura de Nestlé y Kellogg, de cereales, tenían sal, grasa y azúcar elevados. Y por lo tanto, ¿por qué los padres durante décadas le han dado a sus hijos esta basura? Porque los padres no sabían que esto tenía sal, hasta 600 miligramos de sal por 100 gramos y hasta 50 gramos de azúcar por 100 gramos. Y por lo tanto, esto permite el derecho a saber, permite ser ciudadano porque te permite decidir. Y lo segundo, que si tiene sello, no puede tener publicidad en la televisión. Si tiene sello, no puede tener compras públicas del Estado. Si tiene sello, no puede venderse en los colegios. Esto no tiene animaciones, no tiene logos, no tiene colores, no tiene juegos. Porque si tiene sello, no puede tener animación. En Chile no se pueden vender la basura criminal de los Kinder Sorpresa. No se pueden hacer figuras de chocolates con Papá Noel. Y esto es un ecosistema. ¿Para qué? Para que la industria cambie. Porque esta industria, si no tiene publicidad, no vende. Y por lo tanto, el incentivo que tienen para bajar sus niveles de sal, grasa y azúcar, para eliminar los sellos, porque si eliminan los sellos, vuelven a tener publicidad, porque ya no es publicidad engañosa, los transformamos en alimentos saludables. Si eliminan los sellos, pueden vender de nuevo los colegios. Si eliminan los sellos, pueden tener de nuevo compras públicas del Estado. Si eliminan los sellos, pueden tener nuevamente animaciones, juegos en sus envases. Pero aquí se establece un derecho humano y se corta la cadena de transmisión, porque no tienen publicidad en la televisión, está prohibido. Y lo más importante, que en Chile esto ha hecho que cerca del 30% de los productos ya se hayan reformulado. Eso es lo importante. Dejaron de ser empresas indecentes, criminales, y se transformaron en empresas saludables, porque no puede engañarse a las personas que tienen hambre.
If I can ask you, Senator, to wrap up, please.
Ok, me quedo hasta acá.
Senator, I didn't want to stop you because you are so passionate and what you were sharing with us was so important. But we really need to keep moving on. But what I loved what you said was that this is a human rights issue, and what has been happening can be considered as abuse because consumers have the right to understand what they are eating. And what was really powerful is how you ended saying, once you passed this, many companies actually started reformulating when they were pushed to it. I know you will be on our panel, so I look forward to perhaps having more conversation with you during the panel time. But muchas gracias, Senor. We will move on now to getting from a country to an expert researcher who has spent a lot of time researching this particular topic. And it is a pleasure to welcome Bridget Kelly. Bridget is an associate professor in public health nutrition at the University of Wollongong in Australia. Bridget has stayed awake late into the night to share with us today, and we are so grateful for your presence, Bridget. So your 15 minutes will start now.
Thank you very much. So good evening, everybody, or afternoon. I have been given this opportunity to provide a brief summary of the evidence and best practice recommendations for policies relating to food marketing and front of pack food labelling. So protecting children from the marketing of unhealthy foods and non-alcoholic beverages has been repeatedly identified at the highest levels of international health governance to be a priority area for childhood obesity prevention. And alongside these recommendations sits a really large and growing suite of operational manuals or guidance on how to develop and implement such policies. These documents offer largely consistent guidance on the recommendations for technical policy provisions and the processes for policy development, implementation, and monitoring and evaluation. And there is also emerging evidence from countries based on real-world policy evaluations to guide good practice. So the evidence on the impact of marketing on childhood obesity is unequivocal. Food marketing likely operates through a cascade pathway of effects, whereby exposure to marketing is linked to changes in children's food and food brand awareness, preferences, purchases and purchase requests, consumption, and ultimately weight outcomes. And there is robust scientific evidence to support these impacts of marketing exposures all the way along this pathway. The evidence consistently shows that children are exposed to food marketing across all media with which they engage in all settings where they gather. And the promoted products are the antithesis of dietary recommendations. In just one study where we combined data from 22 countries looking at TV advertising to children, the rate of unhealthy food marketing was significantly higher during children's peak viewing times, which were defined as the top 5 hours based on audience data compared to all other viewing times. And these time slots when children were viewing went right up until quite late at night, so 10 p.m. and beyond, which has important policy implications. Strikingly, when we compared advertising rates across countries with different policy arrangements, we found that the rate of unhealthy food advertising was significantly higher in countries that had industry codes of practice for responsible marketing compared to countries with no policy. And we also found that countries with government regulations weren't doing any better than those with none or industry codes. So there was no significant difference. So that is related to significant loopholes and weak policy provisions at the time. While research and policy have tended to focus on TV advertising, children's exposures to digital food marketing are even more concerning, I would say. In an Australian study, we found that children, for every hour that a child would spend online on their mobile device, they would see 17 food promotions per hour, most of which were unhealthy. And you'll recall that the rate of food promotions, unhealthy food promotions on TV was around 3 per hour. Most promotions were what we would call earned media, which is those promotions shared by third parties, such as online influencers or community pages. And again, this has policy implications whereby restricting only paid advertising in paid marketing space will not guard against most exposures online. As indicated, there are significant detrimental impacts of food marketing on children. To highlight just one important review of the evidence related to the effect of food marketing on food consumption under experimental conditions. In this meta-analysis, we found a significant effect of moderate size, whereby food advertising exposure was associated with higher food intake. The policy response to this issue has been variable. This is some information from the WCRF Nourishing database, which documents best practice policy globally on promoting healthy diets. You'll see that a number of countries have introduced government regulations, but the overwhelming response has been the introduction of food and advertising industry pledges for responsible marketing. The weaknesses of these industry pledges have been well documented and include the media covered, the definition of children, the permissive nutrition criteria used, and their voluntary nature. And evaluations, such as this review shown here, indicate that children continue to be exposed to high levels of unhealthy food marketing despite the introduction of these pledges. And authors conclude that policies need to have stronger government oversight as per WHO recommendations. Now, I really can't sum up the evidence any better than the former WHO Director General, who said in her speech to the Commission on Ending Childhood Obesity that there was one particularly pervasive driving force for childhood obesity, the globalized marketing of unhealthy foods and beverages, and that voluntary initiatives were not likely to be sufficient and regulatory and statutory approaches were required. So to that end, what are the recommendations for good policy practice? So that includes, so this is really summarizing from those multiple guidance documents that I showed earlier on how to develop food marketing policies. So good practice policies are those that are government-led, include objectives to reduce children's exposure to unhealthy food marketing. In contrast, vague policy objectives or those that are only based on really long-term outcomes such as childhood obesity prevalence are more likely to be subject to legal challenges and are challenging to evaluate and attribute observed changes to the policy. They should also apply to all marketing, otherwise marketing shifts to unregulated media. Policies should seek to restrict all marketing that children are exposed to. Alternatively, policies that are focused only on child-directed marketing are more permissive and children remain exposed to high levels of marketing in media segments that aren't specifically targeted to them. So for example, primetime TV and social media platforms, which have all been very well documented. Children should be defined as 18 years or younger, as set out in the UN Convention on the Rights of the Child, and to define foods that are not permitted to be marketed. Food classification systems should be evidence-based and align with national dietary guidelines. WHO nutrient profiling models have been developed in all regions and could be adapted or adopted. Shifting now to focus on front-of-pack labeling. Modern retail environments offer vast selections of processed packaged foods and environments that are unsupportive for shoppers to make healthful food choices. So modifying the retail food environment may be useful, including by signposting healthier choices. And again, WHO and UNICEF recommendations and mandates highlight nutrition labeling as one policy measure to support healthy diets. In particular, front of pack labeling refers to nutrition information, obviously on the front of pack, that's intended to support healthier choices, discourage unhealthy choices, and may also incentivize positive food reformulation. A large number of front of pack labeling systems have proliferated in international markets, and these differ in their visual appearance, the extent that they use graphical, numeric, or text information, and vary in their underlying nutrient profiling method, making it confusing for policymakers and consumers alike. There are, however, two major schema of front of pack labelling, interpretive and non-interpretive systems, and these essentially differ in the extent that they provide judgments about the nutritional quality of foods versus nutrient information. To be a little bit more specific, endorsement logos identify better for you products within a product range, and those that don't meet a certain threshold or criteria have no label. So they're an indicator of healthfulness and not unhealthfulness. Summary indicator schemes provide graded information on products' overall healthfulness, so both good and bad. Interpretive nutrient-specific schemes typically present ordered bandings or thresholds of individual key nutrients using colors or words, and they can provide both negative and positive judgments, such as the traffic light label, or negative judgments, such as warning labels. And lastly, non-interpretive nutrient-specific systems, which provide information on the quantities of nutrients in a food and often the percent recommendation recommended daily intakes this equates to for a reference adult. So the pathway of effects of front of pack labelling on supporting healthy choices is shown here. It links label use and understanding and application during food selection, and puts forward that the identification of healthier products will positively impact on choices and therefore dietary intakes and health outcomes. And again, these outcomes along this framework are underpinned by research evidence, which point to more effective front of pack labelling systems. So there is
5 minutes.
Sure. As I have limited time, I'm going to focus on just summarizing some of the evidence at the later part of this framework. So in a review that I led for the WHO Europe, we synthesized information on interpretive front of pack labelling policy processes across Europe to support policymakers in navigating these processes. The map here shows the countries that we were specifically looking at with different labels. Evaluations found that there was some evidence that consumers that are mostly influenced by labels are those that are already health conscious, and also that consumers tend to make choices based on negative evaluation judgments rather than positive judgments. So it's really important to include that information around the foods to avoid. Less information was available around the effect on actual food purchases. There was information that self-reported purchases, self-reported preference for purchasing foods with endorsement logos is actually bared out with actual purchases, but that endorsement logos can be associated with a price premium because, of course, it is a marketing attribute. Studies assessing the effect of labels on diet and health are mostly modelling studies, and they predict the impact that labelling would have on diet and health. These do predict better dietary intakes under replacement scenarios, so replacing foods with a healthier choice based on labelling profiling, but real-world studies have had more modest findings. Based on the evaluation evidence and the synthesis of information about policy processes, we made a number of considerations. We identified a number of considerations for the adoption or review of policies. To highlight just one of these, the report suggested that governments should consider utilising a system that provides both positive, negative evaluation judgments with or without positive evaluation as well. Complementary to this report, this document, front of pack labelling, guiding principles and framework manual for front of pack labelling outlines 15 guiding principles for policy development, implementation, monitoring and evaluation of front of pack labelling systems. And I just want to highlight a couple of these principles here so that the policy should be government led and involve broad stakeholder engagement, that it should be interpretive and understandable to all population subgroups based on consumer testing, that uptake should be encouraged across all eligible packaged products, and that public education campaigns should be run to improve label understanding and use. Just lastly, it is possible that a nutrient profiling method, a model, could underpin both policies relating to both marketing and labelling, but some adaptation may be required. So depending on the front of pack labeling system that's adopted, foods might be classified based on either nutrient thresholds, so meeting a standard, so for example, milligrams of sodium per 100 grams, or they may apply an algorithm to determine an overall nutritional profile for a food, such as 3.5 out of 5 stars. Alternatively, systems for nutrient profiling for food marketing, such as those developed by the WHO regional offices, have applied threshold amounts using binary criteria, so either meets a standard or does not meet a standard. And so there is adaptation required in that kind of a system if it's to be applied to front of pack labeling. The guiding principles and framework manual for front of pack labeling that I mentioned does have a supplementary material that goes through nutrient profiling methods and the processes for adapting or adopting models. And finally, but by no means an afterthought, are the human rights considerations for implementing these policies. So the Committee on the Rights of the Child, which is entrusted with interpreting and monitoring the UN Convention on the Rights of the Child, interprets children's right to health broadly. So this includes ensuring a healthy and safe environment. The committee has specifically noted that the food industry spends billions of dollars marketing unhealthy foods to children, and that this should be regulated and controlled. So too, the right to health for all people extends to an adequate and safe food and nutrition, a supplier for food and nutrition. In 2018, the UN General Assembly acknowledged the importance of human rights in the global response to NCDs, and that states should commit to take necessary measures. And the implementation of interpretive front of pack labeling is a rights compliant measure. So thank you so much for your time, and I wish you all the best in the rest of the session. And I would be happy to answer any questions during the panel or by email. So thank you.
Thank you so much, Bridget, for doing a whirlwind trip around the evidence. And it's so wonderful to see how the evidence is growing and growing. And I think between what you have shared with us are very clearly the evidence. And we heard then from the senator that high-level political will. We can see that with high-level political will and with all the evidence, now we need to see the actions, and those actions need to happen at the country level. So I'm going to ask you just to stay with us for a few minutes more, Bridget, because I'm going to ask you one question. But first, I'd like to get my panelists up as well. So it is my pleasure to also ask our panelists to turn on their cameras. If the senator, I see the senator is still with us, so it's great that we have Senator Girardi back with us. And I do ask all my panelists to forgive me for the incorrect pronunciation of their names. For the rest of the panel, I will be using your first names because I really want us to make this a conversation. Let me first introduce Dr. Saipin Chatavichin, who is the Director of the Bureau of Nutrition at the Department of Health in the Ministry of Public Health of Thailand. Then it is also lovely to see our colleague from Mexico, Dr. Victor Villabos Daniel, who is the Technical Coordinator of the National Center for Disease Control and Preventative Programs. Then we also have with us from the United Kingdom, we have Amy Smillen. Amy is the team lead from the Healthy Weight Office of the Office for Health Improvement and Disparities at the Department of Health and Social Care in the United Kingdom. And then we have from Israel, our colleague Ranit Endfeld. And Ranit is the Director of the Nutrition Division of the Public Health Services of Israel from the Ministry of Health. And then we have from France, we have Roxanne Bergerouet. I'm sure I've said that wrong, Roxanne, but feel please most welcome anyway, as the International Affairs Advisor to the Ministry of Health in France. And then we have 2 colleagues joining us from Saudi Arabia. And it is wonderful to have with us Faisal Fahad bin Sunaid, who is the Director of Healthy Food Department. And joining him as well is Tagreed Mohammed Al-Farai, who is from the Senior Standards and Regulation Specialist. So wonderful that we have all of you. I do have to ask you, Roxanne, that I would ask you to speak English if you are okay. Unfortunately, our French to English translators were not appointed for this meeting because there are so many meetings. So Roxanne, I trust you will be comfortable speaking to us in English. I know your English is much better than my French, Madame. So we've talked about the time for action being now. And what is exciting is that we could have so many country colleagues join us to talk about the actions that they are doing. But before we get into that, and before I let Bridget finally get some sleep, Bridget, I'm going to ask you a question posed by one of our colleagues. And she asks you to share with us what are some of the costs that the industry have to incur in pursuit of front of pack nutrition labeling. I'm sure they always use an excuse of, oh, this is going to cost us so much and it's going to make food more unaffordable. But let's hear from you, Bridget, associated with costs.
Well, thanks for the question. I think that others would probably be better suited to answer this question. So those from industry, for example, or those maybe from governments who've heard from industry. As an outsider researcher looking in, certainly the cost argument is always there, that it will cost so much money to, repackage and, rearrange labels, but that happens all the time. You only have to look at the frequency of different marketing campaigns on labels, for example, for festive seasons and promotions and the like, to see that it is possible and that it indeed does happen regularly. And so I certainly don't want to diminish, and I'm sure you may hear or see some questions, some responses from industry in the chat, but from an outsider's perspective, labeling on pack, irrespective of nutrient labeling, does change all the time.
I think that's such a good point and a great argument back, because indeed it does change regularly. Thank you so much, Bridget, and any of the other countries, when we talk, you might want to add to it. But Bridget, we're also going to let you go, and thank you so much for having been with us. It's been wonderful. The recording will be made available. Bridget's presentation will not be shared as a PowerPoint because Bridget did share with us some yet unpublished research, if I am correct, Bridget. So we won't be sharing her PowerPoint presentation with everybody, but the recording of the session will be shared. Super. Thank you, Bridget. Now to this great selection of countries, and fortunately we do have a good 40 minutes for our discussion, so let's hope we can get to lots of points. I'm going to start with Saudi Arabia, and I'm not sure whether Faisal or Tagreed will take this question, so I'll leave it to you to decide. But why I'm starting with you is because we've heard in the sessions now about both voluntary and mandatory options existing. And if I understand correctly, since 2018, Saudi Arabia had a voluntary front of pack label approach, which was a multiple traffic light approach. But I understand now that you've taken a further step to actually make it mandatory. So I thought it was really good to start with you to tell us more about these reasons of going from voluntary towards mandatory.
Sure.
And I see, Faisal, you've taken the microphone, so over to you.
Yeah, thank you so much, Jane. And thank you so much for all the panelists and for the WHO and UNICEF for organizing such an event, an amazing event. Actually, I'm not going to say we've taken further step. We've escalated to mandatory approach, actually. Just in a way, summarizing the whole story. Actually, our story began in 2017 when we were set, actually, when SFDA or Saudi Arabia, represented by SFDA, has planned to set a multi-sectorial approach to actually face obesity and non-communicable diseases. As you know, according to our statistics in the, published by Ministry of Health, unfortunately, the prevalence of obesity accounted for almost 59.4% of the whole community, which is, I guess, a huge number, to be honest with you. In addition, if you will go back to the WHO reports published in 2016, you will find actually the total deaths, 73% of total deaths in Kingdom of Saudi Arabia comes basically from non-communicable disease. So I guess we need to take an action, to be honest with you. So in 2018, Saudi Arabia, represented by Saudi FDA, has actually launched its healthy food strategy. The healthy food strategy actually contains a lot of objectives. One of the main objectives is introducing multiple traffic light labeling to the consumer as a voluntary approach. Then I guess in 2019, between 2019 till 2020, we've started to monitor and actually assess the compliance of the food industry and the uptake of the food industry to the voluntary approach. And unfortunately, wasn't that much good, to be honest with you. Like, according to the data that's been published in our recent studies, basically 1.8% of the total companies that have been surveilled during the monitoring report actually adapted the front of pack labeling. And if we will go deep to analyze it, I will give you just some numbers. Like, we've assessed almost 4,335 food companies, and only 80 companies of the 4,300 had actually front of pack labeling. If you will go deep inside to the 80 companies, 65% of these companies, or sorry for that, 59.4% of these actually companies had the general daily guidelines allowance. When it comes to the front of pack labeling as a traffic light labeling, which is the one imposed, or which is the one actually Saudi FDA has been urging the full industry about it, only 35%.
Wow.
So
I'm going to ask you just to wrap up quickly.
Yeah, of course. So at the end in 2021, we've decided to take a bold step, actually. We've decided to go ahead with the mandating the multiple traffic light labeling. We do face a lot of challenges on that, but rest assured, we are actually, inshallah, gonna face it with a good,
Inshallah, you will have the strength of us behind you to support
inshallah.
you in
Thank
that.
you so much. We do appreciate it.
So
Thank you so much.
I will also come back to some more questions for our everybody. Amy, I want to go to you next, because I saw you kind of smiling when we were talking about like the voluntary and the mandatory. And I think the UK really has, taken some bold steps. So perhaps just share with us some of the rationale around how you've gone about your process, and how did you get it on that policy agenda, so much so that you even kind of really have a division kind of dealing with healthy weight?
Sure, thank you very much, Jane, and thank you for inviting me to speak today. The answer differs for the UK depending on what policy we're talking about. So you're correct that for front of pack, we have a voluntary scheme. We're in a listening stage at the moment. We're in an opposite situation to our colleagues in Saudi Arabia, where we have actually had quite good uptake of the voluntary label with the UK industry and with all retailers using it, and a large proportion of our manufacturers using it. But we're listening, and with exiting the European Union, we now have the flexibility in order to make a front of pack scheme mandatory, but we want to make a really informed decision before we go down that route. So we're looking across to what colleagues around the world are doing, what new labels have been developed since the UK's traffic light was created back in 2013. Looking to other policies such as advertising, we've obviously, well, not obviously, colleagues may not know, we committed in June this year that we would be introducing a total online ban for HFSS products at all times online, so that's paid for advertising, and then a 9 p.m. watershed on TV, and that's due to come into force on the 1st of January 2023. The reason we made that decision to not go along with the existing restrictions and which on non-broadcast were largely voluntary was because we hadn't seen the action that we had wanted. Government was really concerned that children were still exposed to high levels of HFSS advertising, both online and in TV, which in the UK is where children have the highest level of exposure. So we had tried to work with industry through, you may have heard of the UK Public Health Responsibility Deal, which preceded the policy that we're currently trying to enact, which is we didn't see the action. We didn't see our children being protected enough. So for advertising, we are stepping in and including regulatory actions. We're also doing regulatory actions in the space of promotion restrictions as well. And we have recently announced that we're mandating the inclusion of calorie labeling in the out-of-home sector for large businesses. So going to your question, it depends with, we're working with industry. We want to see where the action's been taken, where the evidence base is, and then we're deciding our approach on whether it's mandatory or voluntary.
It's so really interesting to see how on sort of the one hand, on a voluntary, you got a fairly good response. On the other hand, when it came to the market, the kind of marketing and promotion didn't get the response. So very interesting. I think Senator Girardi, I know that you have to leave shortly, but I think you've now heard some of these speaking, and Chile has had a lot of experience. The question I'm going to ask you is one that is in our chat box from one of our colleagues, and I know you will be able to give us lots of examples. Senator, what are industry's arguments against the kind of packaging requirements that you have made? What did you hear from industry as to why it shouldn't happen?
Bueno, yo creo que la industria lo que quiere, y yo creo que aquí no hay que, yo quiero hablar por lo menos con transparencia. La industria tiene de rehén al mundo político en general en todos los países del mundo. Y lo que la industria quiere es la autorregulación, que no sirve. Porque si ellos saben muy bien los daños que están generando hace muchos años, igual que el tabaco. Entonces, no hablemos de autorregulación, porque eso es ser proindustria, ese es el discurso de la industria. La industria quería en Chile el semáforo, porque nosotros iniciamos esta ley en el año 2017 con el semáforo. Pero la industria vetó el semáforo. Nosotros hicimos 2 encuentros mundiales de obesidad en el año 2008 y 2011, invitamos a Pekka Puska, a los principales líderes en ese tiempo, y la presidenta Bachelet en el año 2008 me pidió que sacáramos el semáforo de la ley. Y lo sacamos para poder ayudar en la tramitación de la ley. En el año 2011 yo fui presidente del Senado, aprobamos la ley, pero luego hicimos estudios con niños, porque es importante que los niños sepan identificar el etiquetado, no los adultos, porque si no lo entienden los niños quiere decir que no sirve. Todos esos etiquetados crípticos del GDA no sirven. Todos aquellos que tienen información no sirven. Todos aquellos que demoran más de ciertos milisegundos en entenderse no sirven. Si un niño de 6 años lo entiende uno de 20, 40, 80. Nosotros creemos que el objetivo de esta industria son los niños, y por lo tanto los niños tienen... Entonces comparamos muchos etiquetados en focus group, y para nuestra sorpresa, yo pensé que lo que los niños nos iban a decir que serviera el semáforo. Y para nuestra sorpresa fueron los niños que identificaron el sello negro. Cuando pusimos el sello negro vino la industria a hablar con nosotros, a pedirnos que repusiéramos el semáforo. Y ahí yo me di cuenta que los niños tenían razón. Y le dije, muchas gracias por haber vetado en el año 2008 el semáforo, porque nunca hubiéramos pensado. Entonces, los que quieran colores no sirve. Aquí hay muchos que trabajan para la industria finalmente, a lo mejor sin conciencia. Pero si no tenemos un etiquetado claro, que los niños se entiendan y las niñas, no sirve. Pero el etiquetado no basta. El etiquetado tiene que conducir a la prohibición de la publicidad, a la prohibición de los juegos, de los ganchos, a la prohibición de venta en colegio. El etiquetado es una puerta de entrada a un ecosistema. ¿Para qué? Para que genere incentivos, para que eliminen los sellos, porque si es solo el etiquetado sirve. En Chile ha disminuido...
Thank you so much, Senator. I'm going to go over to our colleague from Israel now. And don't worry, everybody, I'm going to come to all of you. I'm sorry, with so many of us on the panel, you might think I'm not going to come to you, but I promise I will. Ronit, I want to hear a little bit about the Israel experience, because I think it's also to do with front of pack labeling. And in addition to you perhaps very briefly telling us a little bit about what you are doing, I'd also like you to highlight for us, what advice would you give other countries going down this avenue?
Okay, thank you, Jane, for the opportunity to be in this important meeting and to share with you our experience. We can help Saudi Arabia, if you like, now that we are friends, how to assimilate the mandatory front of pack labeling. I think mandatory front of pack labeling is crucial and not voluntarily, because when you do voluntarily, especially if it's a judgmental one, then the products that don't have the green light won't use it. So what we did is we did the front of pack labeling for high sugar, high saturated fat, and high salt. And we did green labeling, which is a positive one, for healthier products, but in other ways that they are not processed. And there was a question here in the questions, how do we mark the ultra-processed food? And what we did is we marked with the green labeling all the products that are not ultra-processed, in order to encourage the industry to produce products that are not ultra-processed. And we also put the green labeling on open market products, like vegetables, fruits, lentils, whole grain, and things like that. In Israel, we have like 60% of the adult men and 55% of the women had either overweight or obesity, and 30% of the children and 50% of the Arab children, the Muslim children. So we have a great problem of obesity. And I think the next step now has to be to make a symbol on ultra-processed food, not only on high sugar, high salt, and high saturated fat as we did, because the ultra-processing is much worse than all the ingredients in the products. Because how the way the food is processed give you the feeling to eat much more, and you don't have satiety value. So I think it's very important. Another step, which is very important, is not to think that the front of pack labeling is enough step. You need accompanying regulations. And when speaking about stopping marketing to children, I think we have to speak about stopping marketing of ultra-processed food to everybody. Like in cigarette, it's, like not allowing, like saying you can pee in the swimming pool in the small area. It's not like that. It's when you do a regulation or marketing to children, when childhood is stopped at the age of 12, at the age of 18, do adults are not influenced by marketing of unhealthy products? Not the adults are buying the products for the children. So marketing of unhealthy products should be universal, not only for children.
Thank you so much, Ronita. I'm sure I will come back to you, but I want to now go to our colleague Roxanne from France, because Roxanne, it would be good. And then don't worry, Mexico and Thailand, I'm coming to you next. For France, I think they've taken a slightly different approach, but let's hear from you, Roxanne, what we're seeing the approach in France.
Thank you, Jane, to have the opportunity and to present the experience of France. So I will try to do my best in English.
We've apologized that we didn't have the French translation.
No, it's okay. France chose in 2016 to adopt nutrition labeling of packaging known as Nutri-Score. Because it was being shown to be the most effective system.
Roxanne, can we ask you to speak a bit louder? We're battling to hear you.
Yes. So as you know, France chose the Nutri-Score from the fact labeling. It's okay like that or not?
Maybe you can move your microphone closer. Let's see.
And in 2017, the French authorities adopt officially the Nutri-Score from the fact labeling because it was being showed with experiences and consumers survey that it's the most effective system for improving the nutritional quality of consumer purchases. So it was adopted by the Ministry of Health at the end of 2017. And the implementation is still going on since 3 years with very good uptake with stakeholders and industries. And France chose to keep the voluntary front of pack labeling instead of mandatory. And still now we have more than 7% of the stakeholders and industry choose the front of pack labeling, which is called as Nutri-Score. So
thank you,
Roxanne.
I will come back to you. We also just, your connection is quite poor. So I will we will hopefully come back to you and see if we can get a better connection. But let me take a virtual flight from France to Mexico. And Victor, I'm going to come to you because I think Mexico is also considered really one of the global leaders and has taken some very bold steps. But I would love you to also just share with us from your learnings, if you were to give some advice to other countries taking this up, what would you be telling them as well?
Yeah, thank you very much, Jane. Well, we have, during the process to get approved the front of packaging labeling system, we learned many things. And we had to find arguments to counteract the advocacy of the food industry, both public and in private. I have to say, the first thing is that we need to choose the regulatory approach that will limit the influence of the industry. Because at the beginning, we started with a regulatory process dominated by the Ministry of Economy. We found the industry had a voice in equal rights as the health sector. And it's impossible that people who make a profit out of the topic can have an objective opinion about what to do. So if we were going to do it again, we will do it in this way. And I would suggest all the countries to try to do this. Find a way in your regulation system to declare from the research centers, the National Institutes of Health or the similars, what is considered low value food from the nutritional point of view. Find a way to declare and to make it legal, to make it a regulatory definition. And then you go down and discuss with the Ministry of Economy about labeling for foods. And then you will have this tool set before. So when you go down to the discussions, it's just about the system to inform the consumer and not about the nutrient profiling or the critical values. We had this discussion until the last moment, like at midnight before we were going to publish the regulation, the industry thought that they could change this all the time. And I have to say it, if it was not because the government changed, if it was not because up to the president, they allow the process to become a public health process rather than a negotiation in the politics or in the economics, we might not have it.
Fantastic advice, and really having, it's so good that it's not good that you learned the hard way, but you having learned the hard way will allow other countries to really take from you and be able to do it kind of in the easier way from the very beginning. So that advice is really important. Thank you, Victor. Before I go to Dr. Saipin, Amy, I just want to come back to you because when I go to Dr. Saipin, I'm going to be talking about marketing again. And I want to just come to you, Amy, and say, there's the question remains in the chat box about, have you got any thinking on the reason why in one country, voluntary measures like in the UK, the front of labeling worked voluntary, whereas in another country like Saudi Arabia, it didn't work, and yet we're talking about the same kind of thing. Does anything cross your mind, Amy, and then Faisal, and then I'm going to go to Dr. Saipin, as to why that could be?
It's really interesting, isn't it? I was sort of reflecting on that point as well. My gut is saying there's probably a bit of a time difference there. I imagine between 2013, when the government in the UK recommended traffic lights, and I think it was 2017 or 2018, Saudi Arabia colleagues were looking at this. There was the evidence based on different labels were already coming through. So I wonder if it's industry thinking. I'm trying to find the right word. I'm struggling really. It's difficult to. I don't know enough about what Saudi Arabia colleagues are doing.
We'll
elsewhere
ask
with
Faisal
obesity.
for his view as well, but I think your issue of timing could well be one of them. And we're not necessarily saying that we have all the answers, but it really is interesting, you know. So Faisal, what's your thoughts on this one?
Yeah, for sure. I think, in my opinion, to be honest with you, I have to say it frankly, like 80% of our food being imported over here in Saudi Arabia. And when it comes to the local industry in Saudi Arabia, it's only represent about like 10 to 15%.
Oh.
So probably we had, to be honest, a lot of pressure coming outside the country in order to not to implement it. And as you know, the major food industry businesses are actually foreigner, as not a national or local companies. So basically, we do receive a lot of pressure when it comes to it. Like, in my opinion, if it comes to the UK side, sorry for that, but I have to say it, like we actually sat with the Public Health England representative and some sort of representative from UK, and they were saying to us like the local food industry in UK are actually willing to adapt it. And that was the case actually. If you'll compare to Saudi Arabia, the small businesses over here or the local companies, they were saying, we will not adapt it until the big companies will adapt it. So that's why we do have the resistance. That's why in UK was working better, I guess, in my opinion, was working in a better situation compared to Saudi Arabia. That's in my, and I have to say something, sorry for that, Jane, but I have to say it, which is something I have, like everyone has to put it in their mind. Voluntary approach is not the good approach to be taken when we are regulating unhealthy diet. So please, I guess we have to take it from now, like to everyone, like a message that the voluntary approach is not the good approach to be used to regulate unhealthy diet. Thank you so much.
Thank you, Faisal. And Victor, I'll come back to you just now, but I do want to get our other two speakers who I haven't given the floor to yet a chance. So I can see they, lovely, thank you for your patience, Dr. Saipin. I know that we're going to talk a little bit about marketing regulations now, and Thailand is in the process of this journey. So share with us a little bit about the Thailand story when you're hearing everybody saying, whether it's front of pack labeling or marketing, it's got to be mandatory. We have to have regulations. Tell us how you are doing.
Thank you, Jane. It's very interesting topic, and thank you. And I feel like I really have a good opportunity to hear other people give the opinion. In Thailand, we just start the process of drafting the regulation in the late 2019. And for the childhood obesity, actually it's become the nation concern since the 2009. At that time, we raised the agenda of childhood obesity in the second Thai Health Assembly. And from that time, actually, they came out with the 3 resolutions. And the first one is the nutritional labeling and GDA, and also the warning message on the high fat and sugar and salt products. And second Second thing is the control the promotion of the marketing in school. And the third one is the legislation measures on the sweepstakes of the unhealthy food. Anyway, since then until now, many things have happened. Like we have the measure in school, like for the health promoting school. We also have the sugar tax and also adapt the technology, try to give the health literacy to the people by developing the application, like a food choice application that people can scan the product and know that it's good or not good for them. And also even have the healthier choice logo. Anyway, all the process, most of it are the voluntary process. I like the things that the representative from Saudi Arabia said about the willingness of the people who want to do it or not, because we have the healthier choice logo. So far, we have done it for 3 more years already. Less than 10% of the products have been like a participate in reformulating the product and get the healthier choice logo. So it's become to us that now the mandatory legislative measures is become to have to get involved in the process. So we started in the late 2019.
That's so exciting, and we're going to watch your journey, and I'm sure we'll be seeing with great interest. But I think to follow straight on from that, I'm going to come to you, Tagreed, because I believe also in the Saudi Food and Drug Administration now has the first version of a national policy on marketing regulations for children. So we hear Thailand has started the journey. Let's hear from you, Tagreed, on the Saudi story on marketing.
Hello, everyone, and good evening. First, I just want to say that I'm delighted to be here with you today. If you allow me to take you through this SFDA journey with this policy, as just Mr. Faisal said, in 2018, SFDA launched the Healthy Food Strategy. That strategy goal to improve the nutritional food product, the value of a food product, and raise the public awareness about the importance of consuming healthy food, which was in collaboration with stakeholders and in line with our vision of 2030, as well as international practices and WHO, of course, WHO recommendation. Later on in 2019, while we just designed the standard draft, we implemented a multi-sectoral workshops. We sit with the private sectors and as well as government agencies and listen from them. We just, in that workshops, we determined the targeted age group of children, and we set it up to 12. That was based on their point of view, of course, and based on the international experiences. In 2020, that we do surveillance studies. We conducted a surveillance studies, which we think it's very important to be done. One of them was published this year, and the other one is not yet published. From these studies, if you want, I can give you further information from that studies. In brief, I just want to say that the result of these studies, we just found that over 90 of food products were low in nutritional value. Just let me tell you, the first study was we want to assess the nutrient content of prepackaged food that have cartoon character on the label or having toys. The other surveillance was, or we just want to review the marketing of unhealthy food to children in social media, specifically in the YouTube, because we just believe that digital media now, it's an integral part of our children's lives. We do know that they use it now for education, access information, for even for their leisure time. children nowadays, they use the social media as much as us adults. So in keeping that in our mind, we just conducted this study. We review the YouTube channels that we can say channels and videos that appeal to children. Our inclusion criteria was to review the channels with the family channels or kids channels, kids YouTube channels. From that study, as I just said, we found that more than 90% of the product were low in nutritional value. So based on this evidence, we just conclude that a mandatory policy should be done. A restriction targeting a restriction on the restricting food adding children in social media is important for their health, for their well-being, for protecting our children, our future generation, and we want also to affect their eating patterns, their choices for food and preferences as well.
Great, thank you, Tagreet, for giving us that background, and we're also going to watch with interest how that progresses as we go along. Victor, you had your hand up, and I think it might have been you were going to contribute to the discussion of between how come one country had success and another didn't, or maybe it was something else you wanted to raise.
No, thank you, Jane. No, it was about the discussion about voluntary versus non-voluntary and about the impact of trade and imports. So we have this discussion. We say to the industry that voluntary is not fair because the companies who commit with public health will be in disadvantage because they had put themselves with more restrictions versus the others. And we don't want that. And in economic terms, it's not important. I mean, in economic terms, it's not really desirable. So we have the support of the economic ministry in that regard. To keep the competitivity of the industry fair, should not be voluntary. Then the second is about imports. They say this is barriers for trade, and we will go to the World Commerce Organization to complain about this. And we say, you know what? They were saying we will not be able to compete with the United States market because it's our large partner in this in commerce. And we say, you know what? No, you're looking at the past. In the past, we didn't have front of packaging labeling systems. In the future, almost all the countries will have. And the sooner we do it, the more competitive you will be in the United States. If the public health authorities in the United States do their work, they will have very soon also a front of package labeling like this. And they just were silent. Because
great. Thank you for sharing those. Senator, I see you've got your hand up, so I'm going to give you a minute, and then we're going to come to a point where I'm going to wrap up, and I'm going to warn the rest of you on the panel, is that I'm going to give you your 30-second message as your wrap up. So get ready on your 30-second message while I give the Senator 1 minute.
Gracias, Jane. Bueno, yo creo que es muy importante que esto es posible. Nosotros, esta es una política colaborativa. De hecho, trabajamos en Perú y junto con el diputado Delgado, congresista Delgado, llevamos la ley a Perú. Llevamos a expertos científicos. Lo mismo hicimos en Colombia. Lo mismo hicimos en México con Calvillo del Poder del Consumidor y con los especialistas en Industria Salud Pública mexicanos que iniciamos esto hace 10 años, con Juan Rivera, con Simón Barquera. Lo mismo hemos hecho hoy día en Argentina. Ya logramos avanzar en Colombia, en México, en Perú, en Uruguay. A mí me ha tocado estar más de 30 países y creo que aquí tiene que haber una voluntad y creo que la Organización Mundial de la Salud tiene un rol gigantesco porque gracias a la Organización Panamericana logramos avanzar en Latinoamérica y yo creo que Europa es quien está más rehén de los intereses económicos y tienen que liberarse. Aquí no sirve la autorregulación, no sirven los etiquetados que no son comprensibles y no sirve el etiquetado de colores del semáforo, de colores de tráfico, no sirve para los niños. Entonces, tratemos de avanzar. La Organización Mundial de la Salud y las instituciones globales debiéramos validar un modelo, porque no sirve que cada país tenga su propio modelo. o si no, nos van a ganar. Este es un cáncer. La industria de comida chatarra es igual que las tabacaleras.
Thank you so much, Senator. That's just really powerful wordings to end of. And as I come to all the rest of you with your 30 seconds, I suppose this is because the world of social media, we've talked how powerful it is to children, is we have to be able to get our key message across in a tweet. So let's see how you all do that. I'm going to give you each 30 seconds because I have a hard stop to respect the time of this meeting and we still want our closing remarks. So let me go to you first, Roxanne, and I hope that we're able to hear you better this time. But Roxanne, what is your final 30-second message to everybody?
So can you hear me?
Yes, we can.
For the bad connection. So it's my 30-second message or?
Yes, your 30-second message as we wrap up.
Okay, so just 30 seconds. I try to be short. So just I wanted to say to go on, like my other colleagues, as we are part of an international network with the two co-chairs of Australia and Chile ongoing on the implementation of labeling first. Second, as you know, since the end of 2020, we are constructing a European governance of the food score with a few European countries, and so we are begging for going on and diffusing the cross-countries action. So we have actually Belgium, Spain, Germany, Netherlands, Switzerland, and Luxembourg. So that's my final message.
Wonderful. Thank you so much. Ronit, I saw you and I said 30 seconds, quickly writing down what you were going to say in your 30 seconds. Let's hear it from you.
Okay. I want to say that we have to be the leaders of the food system and not to be led by the industry. And we have to think 2 steps ahead before what they are doing. And we have to be united. And I think the power explanation and example of uniting all the South America countries together with the labeling and the marketing and the nutritional guidelines is a very good example of how you can unite it in order to stepwise, very important steps in order to have healthy and better food environment. And I think
wonderful. Your tweet was perfect. Thank you. Amy, you've got 30 seconds. How are you going to use yours?
Thank you. So I think there's 3 things from me. I think it's stay close to the evidence and the data, stick close to your lawyers, and what Ronit said, think about 2 steps ahead. We are thinking about evaluation, about marketing restrictions in the UK, because we're going to have the same fight that we've just had in 5 years' time when we have to make the case that these restrictions have to stay.
Wonderful. Tagreet, you've got 30 seconds. How are you going to use your 30 seconds?
Sorry. I just want to say from our experience, we recommend many steps. First, we have to conduct multi-sectoral workshops, especially with the private sectors. And the other important thing is to conduct national surveillance.
Perfect, wonderful, great use of 30 seconds. Dr. Saipan, what are you going to tell us in your 30 seconds that you want us to remember?
Yeah, I just want to mention that just only the law is not the thing that's gonna help if other measure is not done accordingly. So I just say that the thing that I think is more important, like to create the health literacy of the people, of the consumer, to let them know that it's their right, that they're gonna have to make this to be the environment that have the healthy diet for them. Thank you.
That's a lovely new addition to the thoughts, so thank you. Faisal, you and Victor, you're getting last word.
Yeah,
Faisal.
sure. Yeah, thank you so much. Just I want to say something that the community should be on board when drafting such a legislation or such a nutrition policy. So at the end, any policy should be driven by public demand. The community will do the pressure for you in order to tackle the challenges that comes from the food industry. Since we do work for both work for the consumer as an industry to please the consumer and for us to protect the health of the consumer. Thank you so much.
Great point. Victor, what's your 30 seconds going to tell us?
Well, using this known as the Pareto law, that 80% of the benefits come from 20% of the effort. I could tell you that after 1,000 marathon hours discussing with the industry and trying to negotiate and to push the best for the public health, the 80% of the benefits based on the complaints from the industry post labeling and marketing regulations comes from restricting the use of cartoons and celebrities and the sort or like in foods that are junk. Those junk food will not be allowed to use this. And according with the industry complaints, this will be the most important factor.
I think all of you will agree that if we were in an auditorium, there would be a standing ovation for all of you as our panelists for sharing with us your experiences. So take it on my behalf from everyone that is listening. We have well over 100 people participating, that we are really grateful to each and every one of you. So thank you to a wonderful panel. We could have gone on for another hour, but we look forward to following your journeys as we go forward. So as we come to the end of this session and we come to our last 5 minutes to respect our time, I have to hand over to Catherine Schatz. Kathy, as we call her, so I find it difficult to say Catherine. Kathy is the legal specialist at UNICEF. And Kathy, I know you've been listening to what we've heard, and it's truly been amazingly interesting. So let's hear the closing remarks from you.
Wonderful. Thank you so much, Jane. And thank you so much to our wonderful panelists. I feel like we were so lucky today to have this group of leaders, global leaders in this space, who are going forward and changing our food system, changing how it works. And not only that, but offering advice to other countries and expertise to other countries to help others be able to do that as well. I think a few very clear themes emerged for me today. And the first is really the points that Senator Girardi made at the beginning about this pandemic we're in, the pandemic of unhealthy foods and leading to chronic disease that are being spread through marketing, through misleading labeling. And this idea that actually Margaret Chan framed very nicely, former DG of WHO, as the corporations as the vectors for disease. It's the companies that are spreading the disease through the marketing, through the labeling, which then is a human rights violation. And as governments are the ones that have to protect the citizens from these human rights violations by, for example, passing laws to regulate marketing, to regulate front of package labeling. And that comes straight from the Conventions on the Rights of the Child, from many statements by special rapporteurs on the right to health. It comes straight from the human rights instruments, that it is the obligation of governments to step in and pass these laws. And we know what works. And that was another theme that emerged so strongly today from the panelists. We know that voluntary systems don't work. And we heard from Saudi Arabia, from Dr. Faisal very clearly, and from others that we know this. We know that industry proposes voluntary systems and they're just not effective. We have the evidence for how to structure, how to write the policies, as we heard from Bridget. We know it works. We know how to do it now. And we know that, most importantly, as was mentioned by a number of colleagues, including experience from Mexico, we need to keep the ones that are going to be profiting from the marketing, the large companies, out of the government-led processes when developing these laws. So we know exactly what works, and we know how to do it. And I think most importantly, we have this global community of experts, of advocates, of those of you in the chat who've been so engaged and have so much good advice, of all our panelists who, as I mentioned, are offering their time, they're offering advice for other countries, they're seeing what is working in their own countries, and they're offering their help to other countries who want to take it. So there are no more reasons to wait. These practices are only becoming more endemic and more harmful, and we have all the tools that we need. So thank you very much for this absolutely wonderful, engaging session. Thank you to all the panelists. Thank you very much to Jane, our wonderful moderator, and to my colleagues at WHO and UNICEF who made this happen. Thank you very much. Back to you, Jane.
Thank you, Catherine. I think you have said it all and we couldn't say it any better, but I did want to say thank you to the wonderful conversation in the chat box and the resources that people have been sharing as well. Really do appreciate it and appreciate all of you attending this session. And very big thank you also to Jürgen, who has been doing amazing behind the scenes work, not only for this session, but all the ones this week. So I think he also deserves a special mention. And we've stuck to our time as we promised. We've respected your 90 minutes. So it leaves us just to say, let the action begin now. Let's not stop. Let's use the Nutrition for Growth as an accelerator for action. The time for words is over. But until we meet again, stay safe, everybody, and goodbye.
Thank you so much. Thank you. Bye.
Thank you so much.